Did the reviewers appraise the quality of the primary studies? Did they use a defensible and well-defined set of criteria or a respected quality appraisal scale? The reviewers did not discuss the studies at length, they did discuss the studies at length, both narratively and in table format, but did not critique all the studies using a specific set of criteria. They did discuss that most of the studies were primarily descriptive and lacked scientific rigor, inconsistencies in definitions of workplace violence, and inconsistencies in timeframes, and there were few statistical analysis. Did two or more people do the appraisals, and was the inter-rate agreement reported? The study did not state if two or more people performed the review, and an inter-rate agreement was not mentioned. Was the appraisal information used in a well-defined and defensible manner in the selection of studies or in the analysis of results? Yes. The study discussed why a particular study was chosen or not chosen. Previous research conducted by other researchers focused on workplace violence and healthcare, but was not limited to the emergency department, and the research was conducted prior to 2004. Because of this, the literature review used 2004 to 2009 data and focused on the emergency department. Was adequate information extracted about methodological and administrative aspects of the study? Was adequate information about sample characteristics extracted? Yes, in this study, it discusses how 4 literature databases were used to gather the appropriate studies for review. Inclusion and exclusion criteria were discussed, highlighting the characteristics about the studies used, such as English and definition of workplace violence terminology and study structure. Was sufficient information extracted about the study findings? Yes, a table was included in the study listing each study that was reviewed. The table included purpose, design, time frame, sample setting measures, and major findings. These findings included small hospitals usually had the least amount of security. Nurses reported feeling less safe than other staff. Assault rates were higher in high crime areas. There were fears in reporting workplace violence, and a majority of the assailants were patients, and most workplace violence occurred on the night shift. Were steps taken to enhance the integrity of the data set? Example, were 2 or more people used to extract and record information for analysis? Yes, multiple search terms were used when searching the 4 databases that were mentioned previously. Potential citations were reviewed to determine if they met inclusion and exclusion criteria. This study did not indicate how many people reviewed the studies. Did the reviewers explain their method of pooling and integrating data? Yes. 16 articles met the inclusion-exclusion criteria and were used in the review. The instrument of measure was noted for each study, then placed in the table comparing and contrasting the major findings. Was the analysis of data thorough and credible? The study explained each study in narrative form as well as table form. The different measurements, types of study, sample design, time frame, purpose, and major findings were also explored. Hence, the data analysis was thoroughly explained. Were tables, figures, and text used efficiently to summarize findings? The study provided an extensive table that compiled all the findings of the various studies. Percentages were also discussed and included in the table. Did the researchers draw reasonable conclusions about the quality, quantity, and consistency of evidence related to research questions? The research developed many conclusions, including there was no consistent definition of workplace violence, as each study used different terms to define it. Examples were physical assault, abuse, verbal abuse, harassment, kicking, punching, spitting, pulling hair, biting, stalking, sexual harassment, sexual assault, and acts of aggression or intimidation. Underreporting was a common thing amongst the studies. Several studies characterized workplace violence perpetrators as often being intoxicated or mentally ill. The study mentioned that there were variations in settings which included community hospitals, research facilities, trauma emergency departments, tertiary care centers, and pediatric emergency departments. There was some concern related to the lack of clearly stated statistical analysis in some of the studies, which questions the strength of the study. There was also concern about the lack of staff that participated in the studies. The response rate was averaged about 60.3%. Were limitations of the review and synthesis noted? Yes. Limitations discussed included selection criteria that restricted the generalization of findings, exclusion of older studies, as this review only included studies from 2004 or later, and the review was carried out by an emergency department nurse with a vested interest in the topic of workplace violence. Were implications for nursing practice and further research clearly stated? Yes. The review indicates that workplace violence in the emergency department is a widespread occurrence that is often underreported. This implies the need for improved safety in emergency departments to create a safe environment for staff. Education needs to be provided to staff based off of evidence-based practice. Further research should include more advanced research designs, such as correlational and predictive designs, as well as intervention studies. Predictive instruments to evaluate risk of abuse would also be helpful, and information on nurses' attitudes and preconceptions, prior experience with abuse and behavior should be studied to reveal any contributions to workplace violence. Thank you. This concludes our review of our systemic article. Thank you.